pleasure to be here with you today, and I hope you've enjoyed the last day and a half as much as I have. My name is Kevin Richards, and it's my privilege to be the moderator for today's panel. And we'll be discussing how we're transforming the public sector in Bermuda and around the world. I am the managing director of Bermuda Asset Management, and I do technology advisory work in Bermuda. And it's been my pleasure to have worked with Michael Dershem and the MAPay team over the last 2 years. And just pass it around to the panel just to introduce yourselves, and then we'll get into it.
Thanks, Kevin, and thanks to everybody in the audience and everybody out there virtual. Michael Dershem, a.k.a. Dersh, CEO of MAPay. We're based out of just outside of Philadelphia, and then our global headquarters is in Bermuda.
Good afternoon, everyone. Ricky Braithwaite. I am the CEO of the Bermuda Health Council, where our mission is to regulate, coordinate, and enhance the delivery of healthcare services on the island. So we are the oversight body, not only the regulator, and I know there's been a lot of talk about regulation, but we are the regulator in terms of healthcare, but we also advise and do a lot of innovation programs within the country. So very happy to have heard all the technology solutions and looking forward to the conversation.
My name is Chris Weir. I'm the CEO of Verida. And I'm super excited to be on this panel today and I guess share some of the exciting work that we're going to be doing in Bermuda. Verida is a Web3 technology company that provides decentralized private data storage and messaging to the Web3 stack that complements existing blockchain technology.
Good afternoon. My name is Mahesh Chand. I'm a CEO and founder of Mindcracker Inc. We are a Philadelphia-based consulting and innovation firm. We are here working with Michael Dershem and Verida to build some awesome solutions.
Great. Well, I really wanted to ground the audience first on just talking about healthcare, why it's so important, and what are some of the challenges today. So Dersh, I just wanted to kick it over to you to just really talk about from an individual perspective, what are some of the problems people are facing, and let's ground ourselves in what's wrong with the system today.
Sure, Kev. So, I look at my, over the course of my business career, I've created several companies in the greater healthcare and pharma space, everything from distribution to biotech startups, clinics. And I look at this quagmire around healthcare and healthcare payments and the amount of money that's spent. In the U.S. alone, it's close to $3 trillion. Worldwide, it's a little over 10.2 trillion. And then you look at the friction that we call it within those payments. Believe it or not, it's about 20-25% of the overall spend in healthcare goes to the movement of money, right? So what does that mean? That means in the U.S. alone, we could free up $600 billion worth of healthcare costs. Across the globe, $2 trillion. Why is it also relevant, Kevin? Because every household eats about 20 to 25% of their total household spend goes to healthcare. That's why it's relevant. And then when we talk about the interoperability of data, meaning the data is stored up in these silos, which our tech friends will talk about, the ability to bring that from a patient-centric perspective, right, and control my data is also a cornerstone of what we're doing and a pillar of what we're building in Bermuda.
Awesome.
And Kevin, if I can speak a little more, I mean, we all in this room, hopefully we see healthcare as important. Our health is important. Our ability to be productive in our jobs and to come up with these great ideas that you come up with every day. And especially in a time like now when we're talking about COVID, if we had just done things and been more prepared from a healthcare system standpoint, if we had better fundamentals in our healthcare system, there's so much we could have done earlier, so many restrictions we could have done away with, so many changes in our lives that could have happened a lot earlier with this if we had just had better data, better coordination, and just better understanding of how this all fits together. Healthcare is very complicated, and the problem is that most people only think about healthcare when they end up in the emergency room. That's the first time they really think about it. But we need to be a little more proactive, and our solutions need to be really geared towards how can we prepare ourselves for the next thing. We have to be modern. We can't think about continuing to do things on paper. every solution that you talked about today has an application, is applicable in the healthcare space. And so this is just a really important conversation to have, because not only is it, as I said, it affects us all, but there's a lot of money. There's a lot of money in this industry.
And I mean, we're coming from a bit of a Western, North American perspective. I think Bermuda is a hybrid system, just like the U.S. is. Chris, Mahesh, I know you guys have some perspective of other parts of the world. Can you just give us a flavor of, is this just a North American problem, or is this a global problem?
Yeah, it's very much global. So in Australia, we have quite a good healthcare system comparatively to some other countries. We're very fortunate. But there is a genuine awareness that the quality of data, the importance of data to make good clinical decisions, reduce the cost, the overhead administrative cost of providing healthcare services. And so the Australian government actually went through a process of trying to get everyone's data in one central location. But unfortunately, people weren't keen on that. They wanted to have consent. They wanted to have control over their data. They wanted to make sure that their data was being used for good intent. And so most Australians actually opted out of this particular system, and the system is no better. So I think one of the interesting things is there is obviously technology that's really important, but getting the social buy-in and community on board is critical as well. And having the technology and the awareness, the cultural alignment is very important for these sort of successful healthcare rollouts.
Yeah, I don't think it's just a U.S. problem, right? It's a global problem. I came to actually U.S. in 1998. So I spent half of my life in India, half here, and I can compare the two systems, right? So it's same problem. We all go to doctors, hospitals. We have to fill out the same damn form every time we go. It's the same thing, same name. Nothing is changing for me, right? They all have your data already multiple times. Now you switch doctor or you go to a different procedure or somewhere else, same thing. So they don't communicate with each other. So in today's world, we are building this tech, all of us building so much. How hard it is. It's just, as Dershem said, it's a matter of these systems figuring out. They don't want to communicate with each other. They just want to control the whole thing.
You're absolutely right, Mahesh. I mean, but when you think about it, it's not a technology issue, in my opinion.
Yes.
And in our tech friends issues, that's what you're building, right? It's a business issue. Where this data sits, siloed off, let's be frank. Aetna doesn't like Cigna. In Philadelphia, Jefferson doesn't like Penn. In the practice management system areas and electronic health records, Athena doesn't like NextGen. Cerner doesn't like Epic, right?
Right.
So where we're accomplishing patient-centric interoperability is what we're talking about, right? And being able to do that, starting at the payment, and then build that bridge over to that clinical data,
Yep.
build relevance with that patient. I think, of course, that's where our roadmap says we're solving a lot of these embedded issues, which are more business, not technology.
Yeah, and then again, second problem is cost, right? And that's one big thing is the cost between these third parties sitting in between the patient and the real provider is just so much, right? And you can talk more on that because you've been working with these providers and this in between a lot, both of you. But and third part is really the credentials part. And my wife, she's a nurse, and you are in the space same. Every time they switch jobs and all that, they have to apply the same thing. They have to go for credential, everything same. There's a whole process. So all these things can be easily combined and streamlined and automated, so it saves all of us time and eventually money.
Yeah, and that's one of the things that we're looking to do in Bermuda, right? And one of our mottos is if you can do it in Bermuda, you can do it anywhere, because we really are kind of a microcosm of the world. We have a hybrid system. Part of it looks very much like the U.S. Our demographic profile in terms of our chronic conditions look very much like the U.S., but we are a UK territory, which means like they're tenants of the NHS, National Health Service, in Bermuda. So we're trying to figure out how to merge these two worlds into a system that actually gets people good health care. We talked about data. We talked about it's a business problem. I would push back that it's not only a business problem, but it is a a health problem and a technology problem, right? So we, as a regulator, we're able to get all the data from all the insurers centralized because we demand it as part of their licensing process. It's great to have centralized data, but the problem is that the data that comes in to some of these sources aren't validated, right? So you have diagnosis codes where there's a male who had a ovary issue, right? So the Aetnas may not like the Uniteds, but that doesn't solve the front end where all these transactions are happening with various nodes within the healthcare system, that someone has to say, let's get this data right. If we're going to make decisions in healthcare, we have to work with good data, right? We can't just put systems together. They have to be smart systems. And the blockchain and accuracy and those kind of things and making sure that someone's verifying this information, huge.
So we've grounded the audience on some of the challenges that we're facing in healthcare today, why it's so important to everybody in this room and everyone around the world. What's the MAPay doing about it? What's our solution look like? I think actually let's start with you, Mahesh, in terms of the technology, and then we'll flow back out to the macro impacts that you guys are having.
Yeah, and that's a great question, Kevin, right? So biggest challenge really is this data. Everybody's holding data. And they are boundaries, right? They're not sharing data. And as a patient, I don't even have control of my data. I remember my son, he's an athlete. He's a high school athlete. I had to go get his data. It took me forever to get approval and this and that, and I don't even have access to that. And sometimes the system is always slow. If you go to a hospital, a nurses are like, today morning our system is slow. Like, why their system is always slow? Because these systems, all healthcare systems we work with, at least 6 of them we have worked with, they are all outdated. They're all obsolete. And they call themselves, secure data because they're protecting from other companies. As a matter of fact, they are the one most vulnerable. They are the one getting hacked all the time because they're running on old technologies. So that's the biggest challenge, one of the biggest challenges. And our challenge with first of all that was Dersh's vision, is that we want to give control of data to patients themselves. So they can do whatever they want. They can allow anybody to access. They don't allow, they can restrict them. That was one part. Other part is that how, when a credential is, or certificate is given to you, or kind of hospital says, okay, you're certified, you can, or some institutes just certify your nurse and all that, we want to make that process streamline easily so they can then share with whoever they want. So that's kind of 2 parts of it. And then, Chris, you want to add more to that? From the credential and authentication?
Yeah, sure. So if just step back at, I guess, the technical level of blockchain, one of the key advantages of the blockchain has been that you can take control of your keys, and there's been, I guess, a lot of talk in Web3 about extending that to taking control and ownership of your data. Verida, I guess, identified some time ago that there's actually a missing piece in that Web3 technology stack to manage that private data for an individual and tying that back to the blockchain. So that's where Verida comes in. So we've got the technology around decentralized identity, decentralized private data, allowing an individual to take ownership of that. And so we created a few proof of concepts in this healthcare space because it seemed like a good fit. And then talking with Algorand, they put me in contact with Dershem, and that's how this whole sort of initiative with Verida getting involved started, because obviously MAPay and Bermuda are really keen on exploring this amazing new opportunity that exists with people owning their own data. And so this is a fantastic way of starting this process, working with credentialing of healthcare professionals in Bermuda, and that's sort of the first objective. And then from there, there's a lot of future opportunities that we can grow from that sort of really solid technology foundation and a really solid sort of buy-in in Bermuda. And it's a fantastic opportunity. I'm super excited to be involved with what we're building here. It's going to be a really fantastic journey.
And Chris, just to give the audience a bit more perspective, tell us more about Verida. What are you guys doing? What's your vision? I know in this context, we'll continue to talk about the MAPay healthcare solution, but give us a sense of who you guys are.
Yeah, sure. So we really believe that there's this Web3 future is going to be transformative across every industry, every sector. And if we can combine the power of decentralized computation that the blockchain offers, and we can bring with that decentralized private data, private messaging, decentralized identity. All of those building blocks create a decentralized technology stack that can compete with the existing Web 2 monopolies. And so there's an opportunity there to basically decentralize every industry piece by piece. And so that's why it's fantastic to be able to explore this in the healthcare sector, because as Dersh mentioned, the economic value, the value that can be derived by unlocking inefficiencies in the healthcare sector are immense. And so by going through this process, there's a huge opportunity working with Algorand to identify and say, hey, look, DeFi is obviously a really big thing right now, but the opportunity that and the value that's being unlocked in DeFi can also happen in healthcare. And from Verida's perspective, we see that providing this technology foundation is a really key piece to unlocking that value.
So Dersh, why Algorand? How did this happen?
How did it happen with Algorand?
Yeah.
Interesting story. So I had a friend just up the road in Boca, a friend of mine for 20 years, who was also friends of Barry at Algorand. This friend of ours is a connector. He knew nothing about what we do on blockchain, but he knew the word blockchain. He knew nothing about what Barry and Algorand were doing, but knew the word blockchain, right? So he said, here's two friends, why don't you guys at least talk, right? That was first quarter of this year, right? We started to talk. We knew, so we were going to start building on Ethereum, and all of a sudden, Barry and team, we started to meet with them. Then on the technology side, we were in total alignment. When you start then drilling back at the synergy that we had at the top management team, just the way that Sylvia, Steve, Sean, Kelly, how they think about Algorand, how they think about the world, and those types. That's in alignment, right? And so I think that's important as we're building these world-changing types of deployments, if you will. So yeah, long-winded story, but it was just truly by happenstance, but probably the best thing that happened to our company.
Right, and I mean, I had the, pleasure of seeing Dersh in action in Bermuda, because I was working with the Bermuda Business Development Agency for the last 5 years, trying to attract world-class companies to our country. We're blessed with a government leader, and we have a premier, not a prime minister, who was a technologist by trade and our youngest ever government leader. And so Dersh, I think, first came to Bermuda in 2018. Our only living national hero pounced on him after he spoke on a panel and said, what you're doing in the US, you should do it in Bermuda. We have the same issues. And I saw a lot of companies come and go. And Dersh kept coming back. And when we started working together, it was very difficult to try to get adoption with doctors, with pharmacies, with the hospital. And Ricky, I want to know how you were thinking about what you wanted to do with Bermuda's healthcare system when we approached you, because Ricky really was the one that unlocked this adoption chicken and egg conundrum that we were facing. So how were you thinking about wanting to make a change in your own healthcare system?
Well, I think part of it is my first 2 degrees were in engineering, so I have some appreciation for technology in general. But we have real world problems to solve, and we can't keep doing the same things over and over again. The healthcare system in many ways is broken. I think everyone's talking about how to fix the healthcare system. If you're going to keep on putting the same patches on it, you're going to have the same results. I'm tired of people calling me and saying, how come my doctor won't give me my records? Right? It is beyond frustrating when someone just in tears saying, but it's my health data. Why can't I have it? So we're looking for technology solutions. So I am all on board on pushing this healthcare system. I don't even know what century this is, to the 22nd century. Whatever that looks like, we have to push, and we have to push the envelope, right?
and Ricky, you and I have talked about it. I mean, there are big issues, and people in the audience know this. It's rising drug costs, right? It's access to care. It is an absolute travesty that in this country, right, in my town of Philadelphia, if I'm on one street of West Philly, right, I have access to the best care in the world. Mm-hmm. I am 15 blocks away at Calvary Baptist, right? Zero access to care. And I have a SEPTA bus taking me to Temple, if I'm lucky. That's crazy. The rising drug cost, again, if we have in rising drug costs, you have pharma at one side of the table, and you have the payer, whether it be insurance company or government, on the other side of the table. And all it is adversarial commerce, right? They want to pay this, they don't want to pay this. And they can sit there all day long. But until we come up, like Chris, like you were saying, some of the DeFi models that we're creating around drug pricing, to get that price into into states, into countries that don't have access, very important. You have a country like Paraguay, 40% of the population don't have access to any care. That's crazy.
But Dersh, I mean, you mentioned in the very beginning, if we can unlock some of these savings, we can use that money to provide that kind of access. We spend so much money on administration, so much time, right? One of the things that I worked on prior to me moving to Bermuda was with Social Security. So when someone's disabled, if they're a veteran, they can apply for disability benefits with the Social Security Administration. It would take you sitting down and having an interview. You go talk to another person, you're handed off to another person. It would take you a month to get those benefits. Working with a consulting firm, we worked on this mega hit system. It's a auto adjudication system where you build in all the business rules, you put in your data, the business rules process, and you get disability eligibility approval within 45 seconds. Technology works, right? We're spending so much money on administration, and we have a shortage of nurses. Turn those administrators into nurses, right? There's so many things that we can do, and people say, well, you're going to lose jobs if you become more efficient. There's plenty of other things for people to do. There's education that can be provided. They can become blockchain experts through Mahesh and your organization, your community organization, and so forth. But there's so much potential that can be untapped if we just stop doing things exactly the same way.
Just to touch onto that, if you look at the DeFi movement, I guess, at its core, it's opening up access to technology innovation and creating more efficient financial systems. And so that's one of the things that's super exciting here, is once we can bring that same innovation that's happening in DeFi, that same those same patterns, and unlock this health data. Once that's unlocked and the individual has access to that data, they can consent to sharing that data to innovators, people that actually want to innovate and improve and create more efficient systems. And so by unlocking access to that data, you actually unlock this huge innovation opportunity. And that, blockchain has demonstrated that that's possible. Somebody in some far-flung part of the world can pick up a computer, learn how the technology works, get access to that information, and create some innovation that everyone can use globally. And that's really the power of blockchain and the power of collaboration, that this whole kind of ecosystem unlocks. I'm from Australia, collaborating here in Bermuda in the United States. And this is all possible because of the collaborative environment that the blockchain ecosystem and community really, drives. And that's super exciting because it creates new business models, new data economic, new digital data models that can start to exist. And so I think that that's where over the next 5, 10, 20 years, this whole model of collaborative development from a technology perspective, and also obviously the business and the government perspective, is going to be it's just going to be so transformative.
So when you talk about 5, 10, 20 years, I'm like, that's too long. We need to transform now. You can't think about 20 years from now. There's changes that need to be made now.
So I want to add a little last point to that. Why Algorand? Why we work with? So Dersh met Algorand team, and we talked, and he explained how, and I then looked at it, the founders and the team, and then yesterday I listened to the founder here, Silvio, and I was so motivated and inspired by the speak, and because all of us are building tech, everybody's building tech these days. We are all focusing on making money. Now, all of these blockchain you look out there, they'll say we are fast, we are scalable, we are this and this, but nobody talks about how they're focusing on the green part and focusing on sustainability and also the inclusion, right? So when I talked to Dersh, I would say 4 years ago, we were in a conference in blockchain, and I did one conference. Atlantic City, you came. So the reason we connected that, his vision was like, how do we have the inclusion of even lower income and underprivileged areas, because that's important to me. And I built one of the largest community in the world. We have, it's called the C# Cornerstone Community for Developers. Last year, in 2021, we're going to have 20 million people visit the website. It's a community. Its own, everything is driven by the community. So when I was talking to Dersh, and that's when my passion since the beginning is, then I I think this makes sense in the team. Once we start talking to the team, how they're always welcoming. So that kind of made us make our decision.
So, and what did we phrase it back then, Mahesh? We changed it from healthcare to human care.
Human care, yep.
Because that's what it is.
Yep.
So it kind of piggybacking on that, you hear a lot of stories, there's movies out about like underserved communities getting exploited around clinical trials and that thing. How is MAPay's payment solution gonna change that? Give me an example, just on a clinical trial basis. What would that look like in a year from, not 5 years, in a year from now? Any insight on sort of how this solution would be deployed to give different parts of the community an ability to access a clinical trial, for an example?
Yeah, and an easy answer would be going back just to the macro perspective and say there's this much healthcare spend, and we chop it by 50%, and this is what the result is, and we can give that back, right? That's the easy answer, right? But I would shift it a little bit, Kevin, to a population that in Bermuda that we've come up with a real novel approach, and that's around indigent care, right?
What's indigent care for those?
Indigent care are those that really don't have care, that are in need. Think about it as charity care that is coming from it's that final safety net. Okay. You have a lot of issues, especially around the payment, and how that payment is going to be accepted by that provider, right? Will they get paid by that government entity? Will it come through, even if it comes through a third-party payer insurance company, right? And then you also have downstream effects of compliance and accountability for that person, right? So if you think about it, by putting, we have some really novel stuff that we're working on in an NFT type of environment for that type of structure, which not only will assure the payment, but also then compliance that person did get care. Because remember, to us, starting at the payment, all else comes around. Everybody else in the ecosystem. As one of our chief managing officers, JP, says all the time, the exhaust is the data, right? And we get it from the payment. So we look at these things, not in an altruistic way, but things that just should matter to all of us, and say, we got to fix it. And we will fix it. When you look at things like you mentioned clinical trials. I was involved in a biotech startup, went very well. But if you look at the expense and the calendar time frame and the overhead around clinical trials, could lead 40 to 50% of the cost of research, right? If we're able to, through these types of technologies, collapse that calendar time frame, right? Which brings drugs to market quicker, faster, right? what does that lead to? Better outcomes, better care, reduction of the overall cost. That's how we think about the world.
And Chris, if I'm an individual using your technology, how can I participate and get value and potentially get income in a new system, in a new world?
Yeah, I think this is where we really get a tight intersection between data and, I guess, cryptocurrency or tokenization. So if, let's say, Kevin, you have your own medical data, you now have ownership and control, and you can benefit from that. And that benefit can be in many ways. It can be that you can go and see another doctor and actually provide your data, even if they haven't got connectivity to some other system, which often can be a challenge. It means that it opens up you to perhaps earn a revenue from your data in some way. So for instance, somebody in Bermuda may opt to provide their data in a consensual way to a drug company in the United States who particularly wants an individual's data that has a particular trait, and they'll pay big money for that. And so then there's a revenue stream back to that individual, and the individual's consented to this. So it's completely, transparent, but it's also efficient because now there's a connectivity there that wouldn't previously exist. And I think that's where there's a lot of opportunity. If you extend this sort of more into the future, and I guess where this could potentially head, an area that we've been exploring is if an individual has their own data on their mobile device, we can actually leverage that to train AI algorithms. A mobile device that has computational power and also has the data that's needed to train the algorithm, that's incredibly useful. It solves the two key pieces for AI training, computation and data. And again, there's a consent model around this. The user can opt into this or not opt into that. And through that model and through the use of tokens, there's a way of, again, rewarding that individual for opting in and participating in that new world. And so the way that I see this is that we're effectively creating this new data rails, this sort of digital data economy. And when we bring the blockchain, we bring private data, we bring consent models, and we empower the individual, there's a range of really interesting ways that this can improve healthcare for everyone.
And maybe that even brings people more in line with this idea of personal responsibility. You have more skin in the game. You have access to your information, so therefore you feel that you have a little more control and you have more responsibility in, what you do with it. I think from a public health standpoint, there's always, the government plays a role, the health system plays a role, but there is personal responsibility. And the more we can leverage some of those concepts and give people control, the goal is to have them make choices that are best for themselves and therefore best for the whole kind of population.
Yeah, and I think with the data, once they have control, we can really also show them, like Apple is doing, right? Okay, this is your health, you should be doing this. Imagine now your app can even tell you, oh, by the way, you ate so much French fries today, like I do all the time. Oh, you should not eat tomorrow. So yeah, basically we can have the AI and all the algorithms and also not only monitor and have your data, but also have recommendations, what your goals are and achieve it. There can be a lot of applications built on top of that.
So we've grounded the audience in what the problem is. We looked at what MAPay is delivering. What's the future global vision for MAPay, for healthcare? We haven't really touched on some of the challenges around cross-border payments yet. Ricky, I wanted to start with you, just from a population health perspective, and then open it up to the panel to really just talk about what do we see as the future? I'm in this to change the world. So how are we going to change the world, and starting with Bermuda and scaling, what's this going to look like?
Yeah, a lot of the solutions are around, and the goals are around transparency and access. You want people to get to a qualified professional faster. You don't want the hold-ups in the payments. You don't want the holds-up in the reimbursement, or being able to understand, go to an office and not know what the pricing structure is going to be. The patient experience has to be a lot easier and a lot smoother. And that's what we see as the result of some of these partnerships and collaboration. We see a better patient experience that leads to better health outcomes. It's a brand new world, and Bermuda is the place for this to happen, right? As I said, you have a closed ecosystem, we have a closed population per se, and we deal with the same issues as any other larger country, but in a closed ecosystem, which means that the technology tomorrow can go from a discussion with the premier, as long as these are evidence-based and good solutions, they can go from the discussion with the premier to implementation 6 months later, right? As long as we're making sure the quality is good and so forth. And in many places, you're not going to be able to do that. And you're not going to be able to test that.
Just to kind of validate that, in 2018, the Premier and the Minister of National Security went to Davos, got a perspective on what was going on around blockchain technology, invited technologists to come back to Bermuda and help us to write regulations so that we could govern this sector. They flew back, they were in our boardroom for 2 weeks, and we had new laws in place by May. So that's February to May. We had one of the earliest legislations around digital asset business in the world. And that's just an example of what Ricky's talking about. Dersh, you want to give it?
Yeah, it's something that Ricky and I've talked about not only from a Bermuda perspective, but also from kind of regional perspective. There's a concept out there, and it's been floating out there for years in pharma, around value-based arrangements, around drug pricing. Basically what it says, in its simplest form, if my drug works, you're going to pay me $2 million. If it doesn't work, you're going to pay me $100,000, okay? Those models, though conceptually seem right, have failed miserably or have not gotten off the ground. Why? We talked earlier about adversarial commerce. There hasn't been anybody that's been able to get that data that the game is going to be played with and then act as referee, and then finally the adjudication of the final payment and say this is the score, right? That's those are the types of novel things that we can bring, and we're in discussions now with Big Pharma around it, that we can bring these new structures to the table, which are game changing. And like Chris said, these are DeFi type models, right? That, all due respect, to all the others that are out there, these are ones that, again, are change an aspect of the globe that, especially when we went through that pandemic. Are these other things, when we're hit with the next one, like Ricky said it very early on, are we better prepared?
So I've heard a story you've told me, Dersh, about patients in an island that are not from that country and trying to get care, and the lack of trust between governments to even pay that bill. And then we've also had discussions about, in my country, in Bermuda, a lot of people go to the US for, executive physicals. We get airlifted out there. In certain islands, they get sent to other islands that have better healthcare solutions or more doctors. So talk about some of those challenges and how, we talked about from a local perspective, but
how long do we have on this?
We got a little bit of time.
No, it's crazy. And the more we keep going and the more kind of rocks we uncover, the more unbelievable it is. I mean, we have a government employee from Bermuda under a government health plan going to an island nation, has some heart issues, some cardiac issues, presents to the hospital, and that government is demanding $50,000 cash on the barrelhead before they let her be seen. That is nuts, right? That's what we're fixing. Because, again, in that type of commerce, what is it about, just in payments? It's about risk, right? And so if we can provide better transparency, reduce the risk, act as that true escrow intermediary, right? Almost kind of silly, almost like StubHub, You have the Notre Dame tickets, I want to go to the game, when FedEx, but in a kind of anecdotal way, if we can say, hey, Bermuda's good for the 50 grand, see the patient, right? Make sure they're seen, and then transfer. It may seem simple, right, when you put it in that context, but these are real world issues that impact everybody every day. Right now, It's $350 billion worth of cross-border care, right? And it's wrought with about 30 to 40% overhead and lack of access. You skip a day, person's day. The outcome can change considerably.
And to even add to that, right, so I remember several of my friends' parents, they come from India, right? They get this insurance. It should be covering them here. Some cover, some don't, but problem is getting the money back. The process of getting that back is nightmare. Takes months and months and a lot of paperwork. So this could solve all these little problems and pretty much streamline the whole thing.
I guess part of I'm looking at the crowd and they're I wonder if they're, well, why should we invest in healthcare? Or why is Bermuda the place? As we started at the beginning, healthcare affects us all. It is a huge industry. There's money to be made in the industry. The reality is there is money to be made. There's money to be saved as well through efficiencies. And Bermuda, acting as a case study for some of these technologies and doing it in a rapid implementation plan, as long as it's quality, we can be the kind of the trigger to expand to not only the other Caribbean islands, or small island states in the world, but back into the U.S., back into the U.K. The whole clinical trials model where you test. We're not going to say test because we're not testing healthcare, but we're doing proof of concepts on a small population so we can show that it's going to be externally valid to a larger. That's a possibility for creating industries, and there's research in there. There's dollars to be made through blockchain and integration within the healthcare system. And Bermuda is a prime place to start some of these fundamental momentum changes.
Just to flow on from that, I mean, really what you've outlined there, Ricky, is the opportunity that exists to improve healthcare and use blockchain technology and the technology that we're all leveraging for this greater good. I guess what I'd call out to everyone who's here in the room today or is on the live stream, there's a huge opportunity here to get involved. This is an open health movement in many ways. This is a collaborative new opportunity that everyone can get involved with. And as I said earlier, just like DeFi, there's opportunities to create new innovations. Healthcare is incredibly complex, incredibly efficient, and there's a huge opportunity to get involved. So all of our contact details are up there, and I'd really encourage anybody who's interested in this space to reach out and start working with us and start to get momentum into this healthcare innovation, this sort of new Web3 healthcare that we are creating together.
And I take that one step further. From an individual perspective, but also from a country, state, and city perspective, right? Kevin, what we're doing on the country side. We're taking these principles that we've learned in Bermuda. We need forward-thinking visionaries in government and in the private sector in these countries, like Premier Byrd, like the senior consul at Georgia in Panama, who we announced. We now have 21 countries in our pipeline. I would encourage and welcome a discussion with Mayor Suarez to see. I guarantee that we would come up with a half a dozen use cases for the city. We're working with a couple states now. So I think it's those types of things where we may not have the total blueprint right now, right? But I think if everybody, again, from a macro perspective, understands where this dysfunction lies and what it means to us as a broader worldwide community, hey, we're all in this together.
And I think we're coming to the end of our panel. We are really looking to blitz scale this solution globally. So anyone that's tuning in around the world, we need local partners. We think the solution is going to have to be a little bit different and bespoke depending on which country we're entering into. But as the panel has shown, I think this is an issue that faces all of us, every country, every individual, every family, and it's a really, really transformative use case on how blockchain technology, how Algorand, how these amazing entrepreneurs, government leaders can really come together, collaborate, and change the world. So I just want to really thank our panel for their time today. Thank you, audience, for your attention. And please reach out to us outside and on email. We're really excited to work with you all, and we thank you for your time today.
Thank you.